Often when we think about liver disease, we think about what's called cirrhosis of the liver or end-stage liver disease. And when we think about that, the vast majority of people think of alcohol as the cause of liver cirrhosis. Yet did you know there is actually a more common cause of liver failure that has nothing to do with alcohol? It is called non-alcoholic fatty liver disease. And almost 25% of the US population has this cause of liver disease and liver inflammation, and they can certainly lead to liver failure. Well, in this video today, we'll discuss exactly what is non-alcoholic fatty liver disease. I'll give you clues as what to watch out for, and at the very end of the video, I'm gonna give you 5 tips you can do today to prevent you from having this silent disease that could end up killing you and causing your liver to fail. Guys, let's talk about food. Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter when you get great tips and tricks like you're learning every week straight to your inbox. So let me start you off with a story of a patient of mine named Brian. Now Brian came to me because he was having some abdominal pain on this right side and no one could figure out what was going on. He had x-rays, he had some blood tests, and he found out on his blood test that his liver was inflamed. There was something going on in his liver, and this could explain why he was having his pain. But Brian never drank alcohol. He had no history of any alcoholic drinks. He was wondering, what the heck is going on? He came to see me, we did imaging and further blood tests, and I diagnosed him with non-alcoholic fatty liver disease. This is why his liver was inflamed and why he was having some pain. So he went through a very thorough regimen of lifestyle changes, weight loss, supplements, and guess what? He was able to lose weight, he felt better, and the pain went away, but most importantly, his liver went from inflamed to back to normal again. And he was so happy and I was happy as well. So what exactly is fatty liver disease? Fatty liver disease is the umbrella term for 2 main conditions under that. First one is alcoholic liver disease, which as the name describes, is basically alcohol causing liver damage and fat in the liver. But the other condition is called non-alcoholic fatty liver disease, and this is what I want to talk about in today's video. Non-alcoholic fatty liver disease is inflammation or fat in the liver from a non-alcoholic source. And what happens is that fat over time will accumulate in the liver, and this has a chance of leading into liver cirrhosis. And as I mentioned at the very beginning of the video, this is the #1 reason of liver failure. It's crazy, but fat being too big is the reason why people will actually die from liver disease. It's more common than either hepatitis or even alcohol. Now, a healthy liver will always have some fat. Not a big deal. It's good to have some fat every once in a while. But when fat reaches about 5-10% in the liver, that's when you start to see the damage and the inflammation. And we can see this either on blood tests or even imaging. Now, your liver is critical to do important life functions. Among them include helping to produce bile, which helps out with digestion, making proteins for the body, helps to store iron, convert nutrients into energy, create substances to help your bloods clot so that whenever you get a wound, you're not bleeding out everywhere, and helps you to resist infections by producing immune function and help out with the immune system to fight off those infections. So if your liver gets impaired, you lose all these capabilities, all these functions. And if that happens, your health will be compromised. It is such a sad state to see patients who have liver cirrhosis because not only is their liver failing, but their whole body is shutting down as well because you lose the function of the liver to do its normal job. Now the good news is that the vast majority of people who have fat in the liver, not a big deal whatsoever. But what's also scary is that 30% of the people who have fatty liver disease end up progressing into cirrhosis. And the scary thing about that is that they don't have symptoms until it's too late. You don't know you even have fatty liver disease unless you actually physically look for it. And there are 3 main stages to this progression to liver failure. Stage 1 is that your liver becomes swollen or inflamed, and we can sometimes see this on blood testing or imaging, and this is called steatohepatitis. Over time, that fat and inflammation will cause scar tissue in that liver. When that happens, you actually have what's called fibrosis. If you get to stage 3, when you have so much fibrosis, it actually scars up your liver completely, and that's when you have cirrhosis or end-stage liver disease. And at that point in time, that's when you lose all the function of your liver and you end up needing a liver transplant to get better. So who is actually at risk for developing fatty liver disease? Here's what you need to know. Number 1, genetics plays a role. If you're Asian or Hispanic, you tend to have genes that make it more likely for you to develop fatty liver disease. Number 2 is obesity, especially obesity around that belly. The bigger you are, the more fat that you have around your belly, the more likely it's going to be for that fat to go into your liver and cause damage. Number 3 is that if you have other consequences of obesity, whether it's high blood pressure, diabetes, heart conditions, not only is that fat or obesity damaging these organs, they can make it more likely for your liver to be destroyed as well. Now, unfortunately, the vast majority of people don't realize they have fatty liver disease until it's too late, until they have what's called cirrhosis. And there are a couple of different symptoms of cirrhosis you should be aware of. Number 1 includes abdominal pain, just pain that you don't quite understand what's going on, just in this area, especially the right side where your liver is at. Number 2, you have nausea or weight loss. Number 3, you have yellowish or jaundiced skin or your eyes look yellow. Number 4 is that you're very tired, you're confused, or maybe you have differences in your sleep-wake cycle. You're up all night and you're sleeping all day. Then lastly, you can have swelling around your abdomen or legs, and this is called ascites. All right, so maybe now you're worried that you may have fatty liver disease. You're wondering, hey, Dr. Islam, I am freaked the heck out. What can I do to prevent this? Here are 5 tips that I recommend to all my patients who are at risk for developing fatty liver disease. Number 1, go on a vegetarian type diet. Now, this is very important. What we have found is a diet that's high in vegetables, with predominance of vegetables, with minimal meat, minimal carbohydrates is the best diet you can be on to prevent your liver from going into liver failure. I know it's hard, I know it's tough, but I will tell you, I've been able to reverse fatty liver disease in thousands of patients who went more on a vegetarian or a Mediterranean type diet. You need to do this to improve your liver. Number 2, you have to exercise. There's so much evidence that exercise is great for your liver. Even if you don't lose weight, the physical act of going for an exercise, for a walk, maybe doing something, those produce antioxidants to decrease the amount of inflammation in your liver to prevent your liver from going to liver failure. Number 3, you have to cut out alcohol. I am sorry, but having fat in your liver is bad for your liver. Adding another damaging effect like alcohol is almost quadruple the whammy on your liver. If you have fatty liver disease, I'm gonna tell you to quit drinking alcohol. Number 4, start adding black coffee to your diet. Black coffee is fantastic, has a lot of antioxidant effects, and we have seen in multiple studies how it can actually reverse liver damage. 2 to 4 cups per day is what you need to help decrease inflammation. Consider adding vitamin E. Now I have to stress, this is very important, vitamin E is not for everyone. If you have cirrhosis, don't have this. If you're a man, consider talking to your doctor because there is a risk for developing prostate cancer. But we have seen in studies that vitamin E in certain individuals can help decrease your risk for developing liver failure. And as a bonus, come on, if you went this far, I'm gonna give you one more. Next tip is to make sure you're a good patient. If you have diabetes, get your diabetes under control. If you have high blood pressure, get your blood pressure under control. If you have heart issues, get that taken care of. Everything affects everything. And so your diabetes affects your liver, which affects your high blood pressure. Get all the things under control, get you feeling better, rein those bad problems in, and your liver will thank you. Here's my call to action for you. If you have any of the symptoms of cirrhosis, call your doctor ASAP. Find out what's going on. If you are a risk factor for developing liver disease, you have diabetes, you have heart failure, you have high blood pressure, get your blood levels checked. And if you need to see a specialist like me, come find me. I'm more than happy to see what we can do to get you taken care of. And if you're interested in more advice on what I give to help out with your liver, don't forget to click this playlist where you can get more information on what I'm talking about. My question today for you, have you been diagnosed with fatty liver disease? What has worked? What hasn't worked? What have you tried? Comment down below. I would love to hear what you guys have to say. But I thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter where you can get great tips and tricks like you're learning in today's video. But thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.